guys, welcome back to Love Always Ava. It's your girl Ava here. Today I wanted to talk about something a little bit different, and I wanted to talk about some tips about when you are on the job as a nurse and kind of just things to remember. But before I start the video, make sure that you like and subscribe. Also hit the notification bell so you're notified every time I upload new videos. And a disclaimer, if you hear any dogs barking, those are dogs outside, so just ignore that, and what's important is the message, right? Okay, let's get into the video. So basically, when you're working in healthcare, whether it's being an LPN, an RN, a med tech, a CNA, a lot of times you work in places like long-term care, like the nursing home setting. Now with nursing home, you usually have residents who have dementia, who have Alzheimer's, they have a lot of health issues. And then with assisted living, it's kind of mostly people who are more mobile. Some of them can even take their own medication. They just need a nurse to oversee them to make sure that they're doing everything correctly. But when you're in long-term care, that's where you have, well, a nurse could have up to like 30, 35 patients, and those are people who really need help, and they call those skilled nursing facilities. Now, in those skilled nursing facilities, it tends to bring people who sometimes are miserable, sometimes do not really like their job, but they're there for a paycheck. And of course, yes, we all need a paycheck. So I'm not trying to say you should only work because you like it. Let's be honest, we work because we need a paycheck and we need to pay our bills. However, even if you are working, especially in a field like healthcare, especially if you are working for a paycheck, you do really need to still do your job and take care of the patients or residents, and you do need to treat them properly. So for a few tips, I'm not going to make this long-winded. For a few tips, firstly, make sure that you wear comfortable shoes because you're going to be on your feet, especially if you are an LPN. Usually in that setting, LPNs pass meds, they do wound care, they do treatments, they communicate with the family members, with the RN, supervisor, everyone basically. So in that setting, usually the LPN does those types of things, and the RN is the supervisor. And you also might have the DON. DON's usually there on the day shift, which is 7 a.m. to 3 p.m. 3 p.m. to 11 p.m. Usually everyone goes home, and it's just you there. Usually the families come by during that time. And then for the overnight, well, you know what the overnight is, but sometimes the residents are awake during that time because they have Alzheimer's and they tend to have sundowning and they get very confused. But anyway, yeah, so some tips I would recommend: wear comfortable shoes, because after a while walking up and down the unit passing meds really gets to your feet. So make sure that you're comfy. Wear nice scrubs, you know, the high-waisted scrubs where they're not falling off your butt during the shift when you bend down to get meds out of the med cart. But even before any of that, well, that's before, yes. That's the first thing to do. But then once you get into the actual facility, make sure that before you take any keys, this is like the most important thing, before you take any keys to count narcotics, make sure that you do a walkthrough if you have time, but definitely make time to do a walkthrough. Make sure all your residents are alive, they're breathing, they're well before you take any keys, because once you take the keys, you're responsible for that cart. And then if you leave the facility after you've taken keys, you can be reported for neglect. So make sure that you don't take those keys until everything is okay, and also make sure you know how many residents you're going to have before you take those keys. Then once you do take the keys, make sure that you actually go through and count the narcotics with another nurse. Sometimes when you get there, say you're running a little bit late and you get there, the nurses before you have previously counted. So sometimes they're being nice and they're like, hey girl or boy, I just counted all the narcs for you, don't worry about it. Yeah, definitely always count those narcs, no matter how nice someone's coming off. You need to definitely protect your license, protect yourself and your bread and butter. So definitely make sure that you count the narcotics. And sometimes if you are late and there are no nurses, still make sure that you count it yourself, or you can get a supervisor. There should always be a supervisor. So yeah, instead of counting it yourself, get a supervisor so that someone else can see that you are counting and that the count, the number is correct, so that you don't get blamed for any missing narcotics. So that's the first thing. Well, that's the second thing. So first thing, wear comfortable shoes and scrubs so that you can do your job comfortably. Second, never take any keys to the medication drawer or the narcotic jar or the narcotic drawer unless you know that everything is okay and you have your assignment and you know what to expect. Third, make sure that you have water. Definitely have water. You don't know when you're going to get a break. You don't know if you're going to get a break. Sometimes if you go to a facility that you're not used to, especially if you're an agency nurse, sometimes you don't know what to expect. So definitely have some water, stay hydrated, have some healthy snacks. And yeah, that's the third. For the fourth one, definitely, well, this is if you want to kind of stay away from drama. Sometimes drama is hard to avoid, but if you want to stay away from drama, when you come in, you know, especially as an agency nurse or whatever you are, be polite, of course, be respectful, get your codes and everything, but make sure that you kind of stay away from the nurses station, because sometimes with the nurses station it's where everyone gathers and they kind of like talk about what's going on. It's like an area to complain, sometimes talk about their coworkers, talk about the facility. So yeah, you don't want to get caught up with that and people start asking you questions, personal questions, asking you for your opinions. You don't know who is who and who knows who's possibly related to who, and you don't want anything that you're saying, whether it's good or bad, to get back to anybody or to anyone where it's going to, again, jeopardize your bread and butter. So the best thing to do is be polite, but keep your distance. Do not sit around at the nurse's station and just like yap. Just, you know, drink water, mind your business, do your job. Make sure that you document, protect your license. For the fifth one, I kind of mentioned it in the fourth tip, but for the fifth tip, make sure that you, especially if you're an agency nurse, make sure that you get all the codes for the buildings. A lot of these different facilities have multiple codes for multiple things so that the residents cannot elope. So make sure that you get the code for the elevator. Make sure you get the code for the bathroom door. Make sure you get the code to get in the building, to get out of the building. Make sure you get the code to the medication room, the treatment room, or the treatment cart. Make sure you have the DON's number. All those things. Make sure you have your login. Sometimes you'll go to a facility and they don't have a login for agency staff, and you have to wait just to get a login to even start your med pass. So that's out of your control. Sometimes that's a red flag if you go to a place and they don't have anything set up, nothing set up for your login. Sometimes that's a red flag and you might not want to come back to that facility depending on how your shift went for that day or evening or night. So yeah, those are my 5 tips just to kind of help you out a little bit as medical staff, especially when you're going to a facility that you're not familiar with. If you guys enjoyed this video and if you found it helpful, again, be sure to like and subscribe. Hit that bell so you're notified by YouTube every single time I upload a new video. I'm trying to be a little bit more consistent nowadays. And if you do have any ideas, make sure that you comment below and let me know what you want to see next. Thank you guys so much for watching. Love always, Ava.